The sense of hearing plays a vital role in the development of speech and language and also monitors the speech of the individual. It gives a security feeling and participation in life. The ears are a complex structure that performs many functions which enables to hear soft sounds over a wide frequency and also withstand a very loud sounds to differentiate sounds that vary in pitch and loudness. Normal human ear perceives tones of frequency range from 20 to 20,000 Hz and also complex signals like speech and music. Both types of signals are used for assessment of hearing loss. Consequences of hearing loss depends upon the years involved, that is degrees of loss, types of the loss and the age of the person. It leads to the loss of normal verbal communication. Tolerance to loud sounds is difficult due to damage to the inner ear. The normal speech development of child is affected with this. Lower speech and language development in children affect their education, linguistics and perceptual development. The persons with these impairments have difficulty in hearing sounds that are spoken and also other sounds. The hearing disability is one of the unique disabilities. This makes the inclusion power to get slower also make it difficult. Unlike other disabilities, the hearing impairment primarily deals with the language and communication. With normal hearing ability, people are aware of signals, they hear various sounds and languages, and they are also linked with other people by active communication. The above all are not gained by a person who has hearing disability. The child with hearing impairment, when lose the support of their family, is turned into hearing handicap. Hearing is the part of the life. Anyone can't think of a life without hearing. It is an automatic process done with several activities. The people with hearing loss do things in a different way from normal people. Since all people have a different hearing ability, the important fact to be understood is a person with hearing impairment is able to manage verbal communication while another person is not able to do it. The individual with hearing loss is different from each other because their functional levels may vary. On the other hand, some may fluently read, write, or even speak. If a child does not depend on the above factors, then there are some other factors that hurdle their development. Their achievements are deployed by some other environmental factors to be checked, like if the child is being treated the right way, if the child have got any hearing aids connected to them which makes possible hearing, if the child is made familiar to sign languages or better communication, if the child is made to communicate at the early stage itself or not, if the child is being cared by the family or not, if the hearing aids fitted suits them properly, and also whether the child is able to hear properly with that or not, if the child has got any neighbors or friends to communicate which will in turn develop skills, if the child is being affected by any other disabilities also, if the child is admitted into the appropriate school or not. When all the above environmental factors are being treated and checked, the child will develop or recover quickly from the hearing loss to compete with the normal person. The factors play a key role to determine the current role of the child and also the future of the child. Hearing impairment is defined as the impairment in hearing, whether permanent or fluctuating, that affects a child's educational performance. Hearing impairment or deafness is when your hearing is affected by a condition or injury. Some people are born with a hearing loss while others may develop it as they get older. Most commonly, hearing loss happens with age or is caused by loud noises. When a child is affected by these types of losses, it loses not only communication but also education and also interest in all other things and likes to live in a lonely state. The child must be treated in the early stages itself to avoid most problems. The treatment must include checking whether the child is capable of hearing sounds clearly, whether the child is affected by some other disabilities, whether the child is familiar to sign languages for communication. When these factors are checked, the child will get a proper recovery. Hearing loss is the inability to hear. It may be total or partial. There are some diagnoses that help in determining hearing impairment, which is measured in decibels. Now, due to advancement in technology, nothing is impossible. Many get cured, also prevent it from being severe. Major stages of hearing losses are family history, deafness for family members, consanguineous marriages, marriage between close relations such as uncle, niece, first cousin, etc., blood group complications, infectious diseases or illness during pregnancy, very poor physical condition of the child's mother, excessive alcohol intake by the child's mother, intake of autotoxin drugs. Autotoxic drugs are drugs that can damage the hearing mechanism if used excessively. Excessive exposure to X-rays. Birth asphyxia, lack of oxygen supply to the newborn due to inability to breathe normally, resulting in blueness of baby due to various reasons. Delayed birth cries, birth weight less than 1200 grams, prematurity, deformities of ear, nose, face and throat, jaundice, high fever or convulsions immediately after birth, infectious diseases, excessive intake of antibiotics, injury to the head or ear, continuous exposure to loud sounds, high blood pressure, diabetes, aging, tumor on the auditory nerve, middle ear infections, ear discharge, etc. There are many factors that cause hearing loss. The major causes are genetic. Hearing loss can be hereditary, they can be inherited from the previous generation. While referring to the genetics, these are of two different forms. One is syndromic, the other non-syndrome type. Is a case in which all medical problems occur with hearing loss genetically, but in non-syndromic type, hearing loss occurs without the instance of any other medical problem. Noise. It is an eventually reacting agent that cause hearing loss. Most of them are affected by noise, that is above the specified required decibels. The people residing near airports have to face this risk in their day-to-day life. The flights landing and taking off create a huge noise of 65 to 75 dB. When people are exposed continuously to this noise, their hearing sense is degraded. Even the crackers being fired at festivals and meetings create a huge decibels of noise. This may affect the aged people eardrum easily. Age. It is a normal state that increases in age cause hearing loss of high frequency sounds. It may be due to illness, continuous exposure to noise and too much of toxins. These in turn react with eardrum and make a hole which result in hearing loss. Sometimes they understand slowly. Some cases when the opponents raise the tone, they tend to hear. Chemicals. There are specific drugs also that cause hearing loss. In addition, these drugs when intake without medical supervision cause adverse effects which damages the central auditory system and cause permanent hearing loss. It does not take place slowly like damage of noise, but react with high frequencies to cause severe damage. Injuries. When people are injured severely on the head, then there is a change of hearing loss. But it is a risky. Most of the head injuries result in death. In some cases, the ears will be injured, resulting in permanent or temporary hearing loss. We are in a position to travel safe and slow. Neurological factors. It is the disorder created by the nerves. In this state, the sounds from outside is transmitted to the brain and understood, but a problem in this transmission cause the hearing disorder. So these sounds are not transmitted to the eardrum, passes through the canal and vibrate. Illness. Some of the illness cause hearing loss. Alcohol consumption and premature delivery, which will result in non-development of auditory nerves. Some diseases like mumps, measles damage the auditory nerves, which are the sensory nerves. Most important is the fetal alcohol syndrome, which is prevalent nowadays. When the mother intake alcohol during the pregnancy, the child suffers from nutritional deficiency, causing hearing impairment or deafness. There are few factors of early identification like location of screening, tools for screening, human resources for screening, cost, challenges for screening, intervention for screening, location of screening. The larger services have dealt with both universal hearing screening and screening only the risk. All India Institute of Speech and Hearing reported screening of 28,750 infants in 5 years. Newborn hearing screening programs were initiated in 2002 by Indian Association of Pediatrics. The children referred or failed in the first test are repeatedly screened after 4 weeks. 2007 reports say that while screening 353 children at risk, 276 were at high risk and 77 at no risk. The report says that 25% of the children are not available for screening. The hostel staff and the parents are not cooperative to screen non-risk babies. Tools for screening are: the tools used for hearing is always related with the funds available for screening. The objective of screening determines the technique and tools used. Behavioral observation technique. It is used even though ear-specific results are screening are not accurately provided. Checklists. It is used to obtain the report regarding the auditory behavior of their children. One such checklist is incorporated in the Interactive Voice Reception System, which is IVRS of the Disability Helpline. Some websites have incorporated 4 such checklists for 4 different age groups. The checklists have been validated and they report the overall sensitivity and specificity of the checklist as 82% and 75% respectively. HRR, which is High Risk Register, continues to be used as a screening technique. Several versions of HRR specific to Indian population have been reported in RCI disability status reports between 2000 and 2003. Several projects use the HRR of American Joint Committee on Infant Screening 2000 as a benchmark HRR. OAE. Most of the makes and models of OAE are fully automated, handheld, and screening instruments. Diagnostic instruments are also available. Thus, OAE screening has been used widely in the developed countries. ABR. Automated auditory brainstem response is used for screening portable instruments with automated ABR and OAE are available. The sensitivity and specificity of ABR has been documented to be very good. However, ABR has been used more as a second step for the confirmation of hearing loss in the screening process. Human resource for screening. Human resource is directly related to the tools used, but the validity of screening results in relation to different categories of human resources is lacking apart from published and unpublished reports. HRR are specifically those developed for medical and non-medical persons that can be administered by a whole range of personnel including trained volunteers. Cost. The total or the estimated cost is not accurately calculated. Challenges for screening. Some challenges that occur while screening newborn or infant are the lack of awareness in both the public and professionals regarding the importance of early identification of hearing impairment. high levels of ambient noise in the test areas like hospitals, deliveries at home, especially in rural areas with the assistance of other attendants, poor follow-up bringing the initial efforts to halt, scarcity of technical manpower, intervention for screening. There are some interventions like the person might not be interested in screening process, the child family may not take this loss into account, they may get serious effects from other disorders. Hearing disability is defined as the inability of the person to hear properly. As the survey conducted by non-medical investigators, hearing disability was assessed based on the quantum of impairment in the better ear. If a person reported normal hearing in one ear and total loss of hearing in the opposite ear, the normal hearing sensitivity have occurred is the process of the survey. Usage of hearing aids is not the only solution in assessing hearing disability. A person is stated to have profound hearing impairment if they could not hear at all, or could only hear loud sounds, or used only gestures to communicate. If a person could only hear when the speaker shouts, or could hear only if the speaker is sitting in front, hearing loss is considered to be severe. Moderate hearing disability is the result if a person with hearing loss does not fit either in profound or severe category. Such a person could ask for repetitions when spoken to others, or would like to see the face of the speaker. In other words, if the person reports difficulty in conducting conversation due to hearing problems, he is considered to be in the moderate category of hearing disability. NSSO Perspective. In 1991, the NSSO, with an extended definition of disability, conducted its 47th round of survey in July to December 2002 on the specific request of the Ministry of Social Justice and Empowerment, Government of India. Its 58th round of survey was conducted adopting the multi-stage sample design methodology. It included information on physical and mental disability, socio-economic characteristics of the disabled persons such as age, literacy, vocational training, and the cause, age of onset of disability, marital status, educational level, living arrangements, and activity status. As this is one among the most comprehensive surveys defining disabilities, in a very careful and guarded way to minimize the trouble on the part of the investigators and respondents. The definition of disability and each type of disability is carefully agreed by a group of experts in their respective areas. Census of India 2001 Perspective. The number of persons with hearing impairment was studied at 1876 in India. In the past, counting of people, the impaired people did not indicate adapting a clear definition. The head count conducted by Census of India 2001 defined persons with hearing disability as those who cannot hear at all, are deaf, or can hear only loud sounds, which clearly excluded people who had impairment but could hear through use of amplification devices. However, the census did include as disabled people who could not hear with one ear but whose other ear is functioning normally. Prevalence and incidence of disability. The magnitude of disability can be compared if we know the prevalence of disability as found in national sample surveys conducted at different points of time. Table 1 and 2 show that there is a significant decline in the prevalence and incidence of disability, including hearing disability. This can be attributed to the general growth in health, education, and infrastructure sector. Table 1 shows prevalence rate of disabled persons per 1 lakh persons hearing disability. Table 2 shows incidence rate of hearing disabilities persons per 1 lakh in normal individuals. The incidence is almost the same in both the rural and urban India. The incidence is also observed to be higher among males than females, as is the prevalence rate. Manpower in the field of speech and hearing consists of professionally qualified persons who are involved in activities related to persons with hearing impairment. Hearing and communication employed in different settings like hospitals, rehabilitation centers, special schools, regular schools, speech and hearing centers, training and research institutions. Training programs. Training programs available at various levels are discussed below. Undergraduate, BSc, Speech and Hearing, AST or BASLP. Postgraduate, MSc Speech and Hearing, MASLP, MSc Speech Language Pathology or MSc Audiology. Training institutions are required to follow the norms of the affiliating universities. Variations among different programs are seen in depth of information. Method of teaching differences in the pattern of examination and in following the semester system as against the annual system. There are also the master's level programs. The bachelor's program currently runs for 4 years. During the first 3 years, the focus is on preparing theoretical knowledge base and providing insights into developing requisite clinical skills, followed by the internship year. Doctoral program. The PhD program in speech and hearing was available only at AISH Mysore, affiliated to the University of Mysore. Some candidates have also got their doctorates in allied streams such as linguistics and psychology from other universities. In spite of interest in pursuing doctoral degrees, the fact that full-time candidates only were being accepted by the University of Mysore and availability of guides were limitations. Special education of the hearing impairment. Special education is being taught as a means of secondary prevention of impairments that provide primary prevention. The aim of the special educators is to enable the children with hearing impairment to realize their full potential so that they can achieve a respectable place in society and enjoy a better quality of life. Special educators are traditionally been placed in special schools for children with hearing impairment. In the prevailing conditions, there are various types of educational programs available in India for children with hearing impairment as given below. Early childhood education or early intervention programs, preschool education for infants and younger children between the age group of 0 to 5 years with varying degrees of hearing impairment. Special school programs for children with substantial degree of hearing impairment. Integrated educational programs for children with milder degrees of impairment in a regular school setup. Inclusive education where children with impairment of different types and degrees are educated in regular schools with normal peers. Apart from this, persons with the disability within age group of 14 to 35 are given the opportunity for education through National Open School, which is NOS. Resources for training. The diploma courses is from the medium with poor knowledge of English, their limited experience in using reference material, utilization of the resource material from Western countries poses a major limitation. Short duration of the programs is an added advantage. Experts in the respective subject prepare requisite material in language and easy to understand. Some experts have also taken an initiative in developing resource material in regional languages such as Marathi, Tamil, Telugu, etc. Research. Since the MED program is being introduced, there is an increased focus on conducting applied research in the field of education of the hearing impaired. However, many graduate level teacher training programs do not include sufficient input to the teacher trainees about research and documentations. Systematic orientation towards research would bring about fruitful outcome. The success of a person depends on the opportunities available to them. This is very true for children with a disability. If children with disability are identified at a very young age and provided early intervention, they will develop optimally and reach their potential for development of enabling them to become contributing members of the society. Parents of hearing impaired children and community play a major role in empowering them through providing a strong and stable foundation with focus on their abilities and acknowledgement of their right to lead fulfilled lives. Undoubtedly, much can be achieved. There is a need to gear the training programs to meet the specific needs of the multilingual and multicultural population of the country. Much needs to be done, especially to retain the professionals to provide quality of services in the cause of which there has been a heavy investment. Persons with hearing impairment constitute a significant portion of our population who can be contributing citizens. Efforts made to provide diagnostic and therapeutic services and the efforts put forth to mainstream them will create an inclusive, barrier-free and rights-based society for persons with disabilities. As children with disabilities are likely to suffer from more than one disability, new training programs have to be developed to enable teachers to handle children with more than one disability. Improved efforts at the planning as well as at the implementational level are likely to bring about the necessary improvement in the education of children with hearing impairment and other disabilities. Although the Government of India has implemented several programs for the disabled, the consequent benefits have not arrived at all, those in need and not in all states. Further, there is also a variation in the types of benefits. Community-based rehabilitation is still in its infancy. It needs to be implemented in all the states of India. This will help all the persons who are in need and develop the nation without impairment and fully educated.